Visuomenės sveikatos fakultetas kviečia į vebinarų ciklą Papasakok savo istoriją. Išgirsite istorijas apie tai, kaip išsaugoti savo sveikatą ir gyventi sveikiau. Sekite naujienas LSMU Visuomenės sveikatos fakulteto Facebook puslapyje. Tai yra visuomenės sveikata, kuri keičia tavo gyvenimą.
Hello, I'm a lecturer at the Department of Preventive Medicine, the Faculty of Public Health at the Lithuanian University of Health Sciences at Kaunas. I'm very glad to have our international team at the webinar and hope that they will try to tell their story for you. And this time I'm trying to give the word to those who have gathered, and please introduce yourselves.
Hello, I'm Lina Danusevičienė, and I am working as associate professor at the Department of Bioethics and Faculty of Public Health. My major is social sciences and social work, and I also came here to talk and to discuss and to put my thoughts and some insights of some cultural issues and social issues regarding public health.
My name is Ujunwa Ekwoku, and I'm from Nigeria. I'm an international student. I'm studying public health at Lithuanian University of Health Sciences. So I'm here to tell my story. Thank you.
I'm Renee White. I am also a master's student at the Faculty of Public Health in the Applied Public Health program, and I'm excited to tell my story.
Hi, my name is Yasmin Adjamine. I'm from Ghana. I am currently a master's student studying public health in Lithuanian University of Health Sciences in Kaunas, and I'm here to share my story as well.
So, dear colleagues, you have come from different countries and backgrounds, and I would like you to tell, how did you find public health? How do you know that we are studying and teaching you here in Lithuania at LSMU? Could you share your story, how you found this?
Okay, if I could start. So I have a background in medicine. I studied medicine, and ever since my third year, I've always had a passion for population and health in general on a holistic basis, and I think that's what public health always provides. So even though I was studying medicine, I always was interested in epidemiology, biostats, things that would promote medicine. So after graduating, I decided to just research my options, and I was already studying in Europe, in Ukraine. So I looked up LSMU, and the whole program kind of just had everything I wanted in a public health program. And I felt a new culture, different people was exactly what public health was about. So I applied and I got in, and I haven't regretted it since.
So for me, I really got interested in public health when I was volunteering in Ecuador. So I was seeing a lot of health disparities and things like that. So it originally got me interested in medicine. And then I started thinking, what all can medicine do for this, for these people? Like, is just being a doctor enough? So then I got more interested in what public health was, and then I was also seeing disparities within the United States, a developed country. So it really just made me start thinking more, and then so I looked up some programs in Europe, because similar to Yasmin, I really wanted an international program where I could learn from other people, different cultures, different backgrounds, and so this is where I found, and this is where I am.
Thank you, it's interesting. And what about you?
So For me, like my underground bachelor's was in biochemistry, so yeah, I was volunteering with the Nigerian Red Cross, with the teams of medical professionals, where we go to rural areas for health outreach, So I went with them multiple times, the situation, it wasn't so promising. I mean, in the rural area anyways, not so much in the city, but in the rural area. So these people, the way they were living their lives and the state of their health, it wasn't encouraging. So, I got interested in the health of the community, basically, because people that live in the city, they can always have access to healthcare, health services, go to the hospitals and stuff. But these people, they rely on the little knowledge they have, from tradition to other things. So I'm like, why not help these people? I mean, even if I can't reach the whole community, I can start with just a little, even from my own community. But in Lithuania University of Health, it's like general aspect of it, not just specific to a particular area of public health. So it's like, if you are here, you have the knowledge of all the aspects of public health, epidemiology, biostats, population health, health promotion. You are not limited to a particular discipline of public health. So it's like, in general, you have a knowledge of different aspects of the public health. So, and here again, specifically they specialize in health. It's a biomedical university, so okay, it's an international program because we learn from others, and we go home, we implement what we have learned. So coming here, it's going to do a lot of good for me in terms of knowledge and experiences. So when I come home, I'm bringing something back that can help my community. So I applied, and so far I've not regretted it anyways. So, thank you.
So the students, and what experience did you have in the public health before becoming a student of public health? Did you have some work performed at a community level?
Okay, so like I mentioned earlier, I studied medicine. So going back home, I would intern at government hospitals in my country. And seeing the wide difference of healthcare and how the average patient that comes to a government hospital doesn't know what to do, or because of, let's say, for example, some cultural remedies or treatments, their symptoms or issues that they may have increasing just because they don't know that, okay, I'm supposed to come to simple things like that. I'm supposed to come to the hospital and get checked, not take matters into my own hands, or, go to a native doctor, or, things. So there are things that happen back home that I feel shouldn't happen. So seeing those disparities and seeing things, that the struggles of how people aren't able to get access to good quality health was one thing that really struck me and wanted me to pursue more in the field of health care. And I felt like what Renee said, I didn't think just being a doctor would be enough. I wanted to know how to change the mindsets of people, really get into their heads and let them understand that educating yourself in the field of health is super important. So that's why just interning at home, and, now what I want to take is, so thank you guys for teaching us, and you know, the fact that the both of you are professors and have your own experiences, and how you taught us in leadership and taught us skills in health promotion, skills that I can actually take back home to teach communities, not just theoretically, but like actually implementing programs that can help them at their level, you know, speaking to them at their level, not making the whole gap in health education so wide, you know, bridging it and making them understand the importance of why coming to the hospital isn't such a scary thing, you know. So yeah.
So like I said before, I'm from Nigeria, and you know, from the way people live, I like focusing on the rural area, because these are the people that get the least of education. So most people, when they go to the city, you know, they get education. Most of the time, they don't go back to live in their village. They just travel. So, but the way the people live, they mostly, it's like they don't have access to quality health services. It's always in the city, the good ones, and they're expensive. So this makes these people, you know, to rely on other alternatives, and the alternatives are usually, you know, spiritual and herbal way, you know, taking plants and herbs, but most problems is usually from the fact that they try to link everything to spiritual.
Yeah, it's very interesting what you're sharing. It seems that it's already different context, yeah, which we would never think, you know, that like the disease is somehow connected to some spiritual issues, yeah, as you're saying. Does it mean that the person who gets sick, yeah, he is not coming to the doctor straight away, but he's looking for some other solutions?
Exactly, yeah. Exactly. No, our first instinct is not to go to the hospital when we fall sick. It's usually when the situation is serious, you know, when you find out that, okay, I have tried, I've taken herbs, I've taken paracetamol, because malaria is endemic. Our first instinct to say it is malaria. Or it's because I've not treated malaria in the last 2 months, that is why I'm sick. So every little health issues we have, the first instinct is to say it is malaria. And the first thing we do is to go to a pharmacist or a chemist and tell them to give us anti-malaria. Like it is not prescription, so you can access it. You can buy it anywhere over the counter. So we'll start self-medicating first. So you are self-medicating. You didn't go for a checkup. You didn't go for tests, you know.
So it means if you want to be a good public health professional, so it means it's not enough to know the medical issues, yeah, but it's very important to know this cultural aspects, yeah, yes. and it's very important to get the connection with people. Exactly. And Jasmine, you said also that people are afraid of hospitals. Why they are afraid of it?
People that are probably in the cities and stuff, for sure, that are more educated than others, definitely understand the need to go to the doctor, but I'm talking about people in rural areas and the below average literate Ghanaian. They see doctors as gods, and it takes a lot for them to just, first off, the system sometimes is difficult. Even accessing a good hospital or clinic in your area is difficult. So the next resort is to go to a herbalist or a local native doctor, or just your own remedies that you've taken from, that have been passed down from generation to generation. So I think the whole problem as to why people get so scared about going to the hospital back home and just, talking to a doctor, is because if you don't have money, it takes so much time to eventually have somebody look at you. And by that time, your symptoms have already increased and you might die.
So it's very sad indeed. And not to end upon that, I think that Renee has to share her impressions, what she has had during her study at school time. Yes?
Yeah.
How did you get involved into that as well?
Yeah, so there are like two major experiences I've had with public health. So the first was when I was volunteering in Ecuador. I went 6 times, and one time was for like medical dental volunteering. So I saw a ton of health disparities. People, like we would go to rural villages or rural towns, and people would come from all over like the area to be treated. They would wait all day. So it was like really crazy experience, because I was thinking, like, if my family has to wait in the doctor's office for 3 hours, they get upset, and these people are waiting literally. They get there at 8 a.m. and we would leave 8 p.m. and they would like wait as long as they needed to. So that was a really strange experience for me. And then I was volunteering at a girls' home, so this was not medical related at all. But I learned about a lot of disparities there with high rates of sexual violence against women. And because of that, there were high rates of teen pregnancy and teen motherhood. And so it really got me thinking, like, what ways could you actually help? Because there needs to be like long-term programs and plans implemented. And then I realized that they don't have a ton of reproductive health care or anything like that, like let alone health care at all. In this area that I was in, it's a more rural area. Obviously the cities there are completely different, but so this was like very prevalent. So that's when I really started, like my wheels started churning about public health and things you could do to make a difference. So for me, I think healthcare and medical care is really empowering, and someone learning, so health promotion like these ladies were talking about are, it's very empowering to know how to take care of yourself. So this is what really got me interested in public health. And then when I went back to United States, I continued my studies. I started working at a research clinic for Alzheimer's and dementia. And since I'm from Kentucky, it's a very mostly rural state. Like obviously we have cities and things like that, but we have a lot of rural farmland areas. And we actually are one of the poorest states in the United States. So from working here, I was learning about a lot of health disparities in my own home. Like people where I'm from, we have a physician shortage, and then even further east, it's one of the poorest areas in the country. There's the highest rates of pretty much everything, like tobacco-related cancers, diabetes, things like that. So it really got me interested in public health and kind of gave me the courage to pursue it, because like even in a developing country, in a developed country, there are the same issues that we need to be addressing, and the same types of programs that we've been learning how to create, we can implement in all these countries.
And you are becoming a doctor after?
Yeah, so I'll go to medical school after this, so hopefully that gives me like a multifocal lens that I can do these programs.
How will you change the situation? Are you strong enough to change something? Because we have listened, and sometimes that's so different and difficult to imagine how different we are with our knowledge from our different backgrounds. But still, do you have the power of changing?
Especially the idea, the fact that you studied abroad, they believe you have a different experience. It's not like someone that is at home. Okay, they look at people that studied abroad in a different way, but it's an advantage for me. I can take this advantage and actually do something better. If I come home and tell them, okay, there is something I want to teach you that is done somewhere, They want to know it. They want that experience, that knowledge, because they think it's so different. Because even when you look at it, the way we do things is different. If, for example, you have family doctors here, right? There's nothing like that really. No one assigns a family doctor to you. We would have shortage of the medical professions. Like, there is this problem we had this year. You know, they have been on strike. You know, the doctors that are working in government-owned hospitals, they have been on strike, and another country offers them a job. They left.
Yeah.
They left the country in search of greener pastures because they think they're going to make it maybe there. So, you know, it's the problem. One doctor, even if you're starting a family doctor, it can be maybe one doctor to 100 patients. It might not still be enough. Our population is more than 200 million, but I don't know how many doctors or health professionals we have. So you're saying people are waiting in the US and for our own women. You can even wait. Okay, of course, if you have money, you can easily go to private hospitals. It's so easy. But if you have money, there you can get all the attention you want. If you want to stay in a VIP, if you want doctors to be attending to you every minute, you have it, but you have to pay so much. I said before, we don't have insurance for any national, so for me, I'm not going to do it alone. I know there are some people that are still interested in this thing, because even if you live abroad, your families are there. So if you hear one day they die, you are still going to come home, because that is our culture. So we need them to have a good health. Now I'm planning to work with this foundation, first of all, to start from there. I'm not starting anything so large that I can't control or handle, but I'm going to start a little, you know, with this foundation, and then from there, hopefully, we can expand to.
Very interesting. I think that gives us hope.
Yes, there's hope.
Yes, this is a hope we have, and I think you have also your plans.
Like Uju said, I want to start in my community. I want to, because that's where it starts. You know, changing that little community of 300 people, letting them learn and understand why they need why health education is important, why not treating yourself is important. You know, little things like that, I feel will go a longer way.
With the healthcare system in the United States, I think the best way for me to be able to make a difference like this would be to work in a private hospital or clinic where, you know, people with good money and things like that, they come to get quality health care. They'll pay out of pocket a lot of the times if their insurance doesn't cover it. So this clinic won't be hurting for money at all. And what I'd like to do, I've got this idea from other physicians doing similar things. But so you take the money from this this like high-end clinic where people have money, and you funnel it into clinics in mostly inner city areas. So where a lot of poor people are, where there aren't a lot of job opportunities, there are poor schools, things like that. And so funnel the money from this high-end clinic into this clinic where you're actually getting to serve people, and maybe it can be like what your insurance will pay, that's it. Like, we won't charge any other co-payments and things like that. So that's what I'd really hope to do, because there's a huge disparity even within cities from the richest to the poorest. There's drastic issues with people not getting the medical attention and things they need. So that's something I would really like to do. And eventually I would like if it could even become like I could open clinics in rural areas and stuff as well. So that's my plan.
It sounds interesting, and I hope that this courage which you have at the moment, that it will stay with you, even you will face some difficulties. Yeah. And I have one more question, because you came from a different country, and you mentioned already some things which are different to our situation, but at the same time, I wonder, yeah, a lot of things we take as for gratitude, and we forget how much we have. But maybe you also can mention something what you found very interesting in here, or what was so different here, that just for ourselves to remind that what we have and what we don't notice, maybe some impressions or some ideas.
Yes. So, of course, the system is different from where I'm coming from. So, like firstly, the type of relationship we have with our professors. I mean, it's so different from what I'm used to. You know, how we can easily access them, and you know, whenever you call them, send emails, you know, they are always there to respond and guide you. I mean, they can give you assignments and you don't understand, and email them, you know, saying, oh, what should I do? I don't understand it. And they're happy, like, to clarify the situation and help you, you know, with the assignment. And again, I like the fact that most of the project assignment is usually, I mean, in your own country. Because this is what actually opened my eyes. There's a lot of things I found out just by doing assignment. You know, even when I was doing this course in bioethics, there are some laws I didn't even know existed, because these things are not implemented. And you know, I can just go out someday and be talking. I didn't even know that actually that thing is where I'm from. So I like the fact that everything is always in your country. How is it? How is it done? What is happening there? You know, we have learned the European way, we've learned the American way, even individual countries. But what of your own country? How? Because this is the thing that is actually opening our eyes to the situation in that country.
I'll call Uju because she's from Nigeria, I'm from Ghana. We're not that different in terms of the experiences we have in our countries. So I'll ask her, I was like, have you found any info about da-da-da-da-da-da in Nigeria? And then she goes, my sister, I've been looking for like days, and you know, I mean, it's funny, like looking back at it now, but like, I really like the fact that we're asked to develop programs and insight and research back home, because at the end of the day, that's where we're going to implement it. So, I mean, yeah. So
maybe if someone is interested in studying here, or maybe in public health, so would you have some message from what you have learned and from what we all have learned from you as well? Because we are teaching and we are learning together. And you are a big team, international team, and we are very happy to have you. So if you want to make a message for all those who are listening, for those who are watching, just you have the chance to do it.
Okay. You know, anyone out there looking forward to studying public health, I would say again, it is such an interesting program. Before starting to study public health, of course, you know, you can easily go on the internet, type what is public health about. Of course, you see things, people are going to write a lot of things, but it's different when you actually experience it. Here, they give you practical experiences. It's not just something off from textbook or from somewhere, but real life scenarios where things have happened, what was done, you know, to solve the problems. So I'm still going to say it again. Studying public health, it's going to open your mind, your eyes to see the real problems in health sector, because we are the public.
Yeah, I completely agree with what Uju was saying. For me, it's incredible that we've gotten so much practical experience. We've made realistic health promotion programs and things like that. Like, we got statistics from these countries. We got So I got to build on the, like, I love research, I love doing research, so I got to really build upon the research background I have and make it really applicable. Like, these are the numbers, what can I do with this? So we've gotten to do projects where we make these plans, and I think actually putting effort into those will make me like a great public health professional in all of us, because it's just really taught us a lot. So with that, I say hopefully you choose public health, and if you do, give it 100% while you're in school, and it'll be so easy once you get out. For sure.
And for me, prior to public health, prior to studying in LSMU, I wasn't what I expected public health to be. You're grabbing statistics and info about past programs, and you know, it really opened my mind to a vast world of health. So I want you, whether you're coming from a medical background or a biomed or health sciences background, you will not be disappointed with a public health degree or program at all. It'll definitely equip you to be a better overall professional in your field. So yeah, good luck to you guys.
Thank you so much. And Luna, what's your message?
My message would be that when we are thinking globally, at the same time, yeah, we have to think locally. You know, how to get this message to the people, that it was accepted, yeah, and to think a little bit deeper, not just that people using certain lifestyles which are not appropriate, yeah, but it's sometimes it is survival strategies and what it means for them to survive, yeah, and when we understand how we survive, we can change something.
Yes, you are full in public health, you know, and since having the medical background, it resonates for me, all your minds that you must help personally and you make the changes for the community. So if you have to act for the community, you have to be very wise and to have real evidence-based facts in order to make wiser decisions. And let your ideas come true. Yeah. Thank you so much. Thank you for being here. And thank you for coming and sharing the time and your stories. So thank you for watching us, and have a nice time and have a good day.
Okay.